My name is William Beach, and I am a sports medicine physician at Tuckahoe Orthopaedics in Richmond, Virginia. I've been here at Tuckahoe since 1991 and have been doing arthroscopy and sports medicine since that time. I did my fellowship here in 1991 with Dr. Kasperi, Dr. Myers, and Dr. Whipple, who at that time were, I think, three of the probably most famous arthroscopists and sports medicine physicians probably in the country and maybe the world. And sports medicine is a little bit of a misnomer because what has developed is minimally invasive surgery. And so we see those issues with athletes, ACL tears, meniscus tears, shoulder dislocations. So there's been a wide array of arthroscopic procedures that were developed for those people in mind. Interestingly then, developed in concert with that were a lot of procedures that are appropriate for people who are older. Rotator cuff tears, meniscus tears, arthritis type issues with the knee, hip, ankle, shoulder, even the elbow and the wrist. So sports medicine may be a bad term with respect to older patients who say, I'm not particularly athletic, so why should I go see a sports medicine physician? And this was Dr. Kasperi's point. He considered himself an arthroscopist. And I think that's probably maybe a better term in some ways because we do minimally invasive surgery. Minimally invasive surgery is appropriate for patients of all ages. And the idea being is that we can do the same surgery with smaller incisions using an arthroscope or a telescope to look inside the joint so that we don't have to cut, remove tissue, and so the recovery should be faster. I've been doing sports medicine, like I said, for over 20 years now, and so still enjoy going to games, seeing players, watching sporting events, being a significant athletic fan is still fun. So I have 4 children, 3 grandchildren now, and so my youngest son, though, plays professional golf, and so that's an interest of ours. All my sons play golf, so we play golf together, and Sammy's really good. I am also have the privilege of being the next president of the Arthroscopy Association, and that will be in 2014. I'm right now the first vice president of the Arthroscopy Association. The ANA experience has been one of the, I think, real highlights of my professional life. Dr. Kasperi, who I mentioned before, was president of the Arthroscopy Association, and so was Dr. Myers. So it's interesting that we have more presidents of the Arthroscopy Association than any other group in the country. So it's been a pleasure, and I've enjoyed my time at Tuckahoe, and I hope to continue to care for sports medicine and arthroscopy type patients.